There you go.
Alrighty, drug addiction and alcohol abuse affects millions of people around the world. Addiction does not discriminate. It's in every religion, every profession, every age group. And this is why we cannot assume that all healthcare workers are drug and alcohol free just because they have a license behind their employee badge. Hello everyone, my name is Sean Zaitis, and today I'm going to be talking to you guys about impaired nursing. And the importance of this is to understand because we don't want an impaired health worker to be working on today's public. So within this presentation, I'm going to be hitting these key points: stress, stealing, addiction, where they can go to get help, the signs and symptoms we can look for, and in all, the outcome of the penalty if these are not met. So to start with stress, the article here discussed, I had found an article by Trim Coffin Store that discusses that nurses in higher physical demanding jobs, such as working in a higher stress, like the ICU or a rapid response team that has more stress on the body. An article shows that there's studies that these healthcare workers are more likely to use drugs than one that just works on the floor that's at a lower stress. Stress has a major role in why a nurse will choose to use drugs. It affects the body physiologically and psychologically. It affects the brain's neurotransmitters, as well as leading them to make irrational decisions to take the drug. So the next topic here is theft. So the next major question is how these healthcare workers obtain the drugs. Well, as we all know, healthcare workers are around medications, every day of their work. So they have more exposure, they have more knowledge of what the drug does because they're trained in that specialty. So, but again, back to the question is how these healthcare workers obtain the drugs. And two main ways that I found are, one is simple, just at the med cart, take the narcotic, swap it out for a sugar pill, tell the patient that this pill, is your pain medication. If it doesn't work, ask for more and we'll get you more. Another major one is, say the medication is not needed for the patient off of an assessment. So what is ordered then, or what is usually hospital policy, is to dispose of the drugs. And for this to be done, the two witnesses need to be present, two other nurses need to be present to sign their signatures to say they have watched the narcotic wasted. But usually in a lot of healthcare facilities, and nowadays it's usually really busy, other nurses don't feel like taking time out of their day to go watch someone throw something down the drain or in the trash. So they'll just sign their signature and run off. So right there's another way that a nurse can obtain a prescription medication. And I'm sure there's many of other ways people have, found ways to take. So my next slide here is just simply drug abuse. Drug abuse and addiction, as we all know, drug abuse is the overuse of a medication, something that alters the mind and body. So drug abuse and addiction go hand in hand. Excuse me. Drug abuse and addiction go hand in hand, and it has major effects on the nurse, because once the nurse starts taking the medication, two things are going to happen. Depending on the type of medication they take, say it being a Xanax, what it will happen is they'll develop a psychological habit of taking the medication every day, and they'll develop a need for it, and physiologically it'll alter the neurotransmitter GABA within the brain, and on sudden stop of the drug it could cause a seizure or death. And this is, there's many of other medications that can do the same or affect them in different ways that can end up resulting in death. So here's just another slide just showing, types of drugs that right here, these are the 4 most common drugs that are found to be taken on the job site: Oxycontin, Percocet, Dermal, Vicodin. These are all opioids. Impaired nursing. So right here. So now this picture represents a nurse on the job site who is impaired under the influence of drugs or alcohol. Some signs and symptoms that we should all look for: the public, being from the outside, from the outside world, not having a high knowledge of healthcare and signs and symptoms. Some easy ones to look for is just sweatiness, impaired speech, impaired gait, just straight out fatigue, any clumsiness. As a healthcare worker, as a co-worker, understanding the signs and symptoms should be a little bit easier for you. What the co-worker is to do when they come across an impaired nurse or another worker is to immediately report to the supervisor and have the supervisor assess the impaired nurse to final the saying that the nurse is impaired. Some signs and symptoms for a supervisor that will look for in an impaired nurse is signs such as diaphoresis, so sweating, impaired gait, speech, frequent times having to go to the restroom, frequent call-offs and stuff like that. So they'll take it back to the past, see if they can mess it up. So another major topic here is not only do we have the impaired nurse, but the greatest risk factor for the impaired nurse is now they're putting their patient in danger. So not only would they get in trouble for stealing the medication, but this is actually the biggest thing right here that will affect the nurse that steals the medication is the patient safety. Because now you're putting someone's life in danger. Now you're taking someone's medication that was ordered by the prescriber to, meet the client's needs, and now you're taking away from the client's needs, and now you're putting somebody in danger, which this ends up resulting in prison time. So the next step to this is if you are, or if you know someone that's an impaired worker on the job site, the next thing is to seek out help. And what a lot of these impaired nurses or healthcare workers don't understand is the job they're working at, the job themselves, is the best resource to get help. Then they think that if I tell them, they're gonna fire me or something of that sort. But honestly, the hospital that they're working at is the best resource to get help. Because if you come out and tell them, clean that you need help, you have an addiction problem, they'll put together programs and treatment plans to better yourself, to get yourself help, and it'll save your license. So all in all, if these roles are not met by the nurse and then failure to comply, all in all, the penalty is prison time. So no one wants that. And here's my references.
Does anybody have any questions for Sean? Any comments?